living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Menopause is a normal stage in women's lives. Every woman's experience is different, so whether seeking relief from hot flashes or trying to stay healthy during and after the transition, today's show provides answers to questions you may not know you had about menopause and your health. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Sarah Medley. Stay tuned. Welcome back. Joining us this morning are Dr. Jack McMahon and Dr. Alexis O'Leary to talk to us about menopause. Thank you both so much for being here.
Absolutely.
So I'm going to start, ladies first, and I'm going to start with you, Dr. O'Leary. What is menopause?
So by definition, menopause would be absence of a woman's menstrual cycle for a consecutive 12 months. But there is a lot more that goes into that than just lack of having a period. And I think we'll get into a lot of those questions today. But definition-wise, that's what it is. When a woman stops having her period for a whole year, then she has gone through menopause.
So what I have read is that menopause is a transition, and I think that's what you're referring to. So how long does that transition take?
So you're correct. It is a transition, and there's a period before that last period that can take several years. Sometimes, a few, 4 to 5. Sometimes women go through it 10 to 12 years potentially. And that period we call perimenopause. So the period of time leading up to true menopause.
So besides the period, as you're describing it, what other phases are there?
What do you mean?
So there are several phases of menopause. So there's a pre, is there the middle part and then the post, or not?
So each woman might experience different symptoms through her individual transition, through her perimenopause and menopausal transition. She may experience some of the traditional menopause symptoms. She may experience all of them, and we really individualize each patient based on what she is experiencing.
So I have been through menopause, and the worst part of it for me was the hot flashes. And I know from my friends' experiences, they would say hot flashes were the worst. Why did we have to have hot flashes? What causes them?
So hot flashes are a decrease in the level of estrogen in your body. So as you're transitioning through this time, perimenopause and menopause, your estrogen is fluctuating, usually declining, and that changes the thermoregulation of your body, and that causes this feeling of a flushing sensation. And it can happen at nighttime, it can happen in the middle of the day. There's really no rhyme or reason to when some women will get them. And they can be very disruptive, as you may know, and most women complain of them at some point during this transition.
So I'm going to switch gears, and I'm going to go to Dr. McMahon for the next question.
Okay.
And let's talk about some of the other symptoms that women experience. So we talked about hot flashes. Talk about a few more.
Generally, the most common symptoms that we treat or that we can treat are hot flushes and then vaginal dryness and vaginal atrophy problems. And vaginal atrophy is also estrogen dependent. Generally, the skin in the vagina and in the areas on the outside of the vulva are 20 to 30 cell layers thick when people are not menopausal and making plenty of estrogen, and 2 to 3 cell layers thick when they are in the menopause and when they have lack of estrogen. And that can cause problems with intimacy. It can cause problems. The tissues just won't stretch adequately. They'll tear. Lack of lubrication. Other symptoms that people will get is depression sometimes. Sometimes people get some mood changes, and it's frequently because of the lack of estrogen, but also lack of adequate sleep. And osteoporosis is something that can develop because of lack of estrogen. Again, the estrogen helps with osteoporosis. So those are the major symptoms I think that we tend to treat, and there's various ways of treating each of those.
So of those symptoms, I'm sure some of them are of concern enough that a woman might want to seek her physician's help. So when would that be? Talk about a few of those. When would I want to go see my physician about menopausal concerns?
What I tell people is it depends on how bad the symptoms are. And the symptoms are different for each individual. I mean, sometimes people are comfortable with any type of problem, and sometimes people are not. So it depends on how symptomatic they are and what they want to have treated. If they're having intimacy problems and they can't have intercourse anymore and they would like to, frequently that's when I'll see people. If they have problems with hot flushes and they want some type of therapy to try to help that, we can. If they're concerned about only osteoporosis, then there's other meds other than estrogen that certainly work. But it really is such an individual thing. It's whatever the person is worried about. The biggest reason we use hormone replacement after menopause is because of hot flushes or vaginal dryness. Incontinence can also be related to that. There's a lot of different symptoms, and it depends on what they need.
So lifestyle changes, are there things that a woman can do at home to maybe alleviate some of these symptoms?
Maybe. Obviously with intercourse, vaginal lubricants can help. With hot flushes, there's a whole lot of medications, I guess is maybe not quite the right term, or supplements that are out on the market that are supposed to help with hot flushes. I'm not sure they really do. But
okay. All right. Well, we need to pause for a commercial break. Coming up next, you probably heard mixed information about the safety of hormone therapy as treatment for menopause symptoms. We'll learn the risks and the benefits and other treatment options right after this. Don't go away. Welcome back. Menopause does not require medical treatment, and many women can manage the symptoms without therapy or medications. But all women experience menopause differently, and there are times when hot flashes and other symptoms become more than a woman can manage on her own. But how do you know what treatment is right for you? Dr. McMahon and Dr. O'Leary are still with us. Okay, so let's talk about some solutions. So when we talk about hormone therapy, Dr. McMahon, what do we mean? What is it?
Hormone therapy or estrogen replacement therapy, or there's a lot of different names for it, but the idea, the thing that you're lacking most in menopause is estrogen. And with the lack of estrogen, you get all of the different symptoms, whether it's the hot flushes or the vaginal dryness or whatever that can be occurring. And it's true that most women, or many women, don't need any type of hormone therapy. That's absolutely true. And there's a lot of scares about the possibility of other side effects caused by the estrogen therapy. But what hormone therapy is it can be a combination of a vaginal estrogen cream, it can be an estrogen and possibly progesterone pill that people can take, or it can be a patch. I guess there's some creams and things that are used by a lot of naturopathic physicians that can potentially help. But it's really supplementing with estrogen, and then at times also using progesterone to protect the uterus from developing other problems, specifically cancer of the uterus. If people have a uterus and they are taking estrogen, they really need to take progesterone as well. And if they don't have a uterus, they can just take estrogen if they take it parenterally or orally or topically with a patch.
So what are the benefits of hormone therapy?
The biggest benefits, I think, are really hot flushes, vaginal dryness. It can help both of those. It can also help with osteoporosis-related bone thinning problems. Frequently, the people's mood, they just feel better when they take it. They feel younger. They just like the way they feel.
But I've read about risks of hormone replacement therapy as well. So can you talk to us about the risks?
Sure. The biggest risk for, again, people that take estrogen alone is that they can develop cancer of the uterus if they have one. If they don't have a cancer or don't have a uterus, then it's pretty hard to get cancer of the uterus, so you don't have to worry about that. So that's the biggest risk. People also are concerned specifically about breast cancer, heart disease, and or strokes. And the best data that we have for the last 17, 18 years would say that estrogen by itself does not increase the risk of breast cancer, heart attacks, and strokes at all. And that estrogen and progesterone together actually do increase it slightly, like 0.07 to 0.08% per year. So there is an increase, although it's small.
How does a woman know if hormone replacement is the right option for her?
She really needs to just talk about different options and different risks and see what she's comfortable with and how bad that symptoms are affecting her life.
So for women who opt for that hormone therapy, are there ways to reduce those risks?
Certainly if people are in better physical condition, that helps. If they can manage their weight, that helps. If they can get adequate sleep, that helps. If they're careful with when they would do a sauna. I wouldn't do it before I went to bed because you're probably going to be hotter. I mean, there's different, open the window. I mean, there's a lot of different things that can help with the hot flushes. Mm-hmm. Anxiety can do that too. There's other medical therapy that can potentially help with hot flushes as well if people can't take estrogen because they've had breast cancer or uterine cancer.
Mm-hmm. So any final thoughts or words for our viewers about hormone replacement?
I think the final thoughts would be, it's really individual. And if you have a question, please talk to your healthcare provider. And if you don't get the answer that you are looking for, don't get all the information that you do, keep asking, or that you want, keep asking. I think it's really such an individual thing that many women go through menopause and go through the postmenopausal years without needing any type of further therapy. And there's other people that really find that the symptoms are bothersome and interrupting their life, and they want to try to treat them.
Thank you. So let's switch gears and we'll talk to Dr. O'Leary about what are some other treatment options that women might want to consider as well.
For other treatments, you could consider depending on their symptoms. So again, like Dr. McMahon had said, specifically if the hot flashes, maybe the vaginal symptoms are the most significant, estrogen replacement is probably the best thing for them if that is the most concerning symptom. But treating specific to the other symptoms of menopause, so say a woman has low bone mass or osteoporosis, you could consider medications to strengthen the bones that are not estrogen, progesterone treatments. Again, he talked about mood symptoms of menopause, depression, anxiety, treating those with sometimes anti-anxiety or antidepressant medications. There actually is one on the market that has shown to decrease hot flashes as well. A certain blood pressure medication can help decrease those hot flashes as well. So there are a multitude of things that we have that can be tried if a woman wants.
Okay, all right. It's time for another break, so we're going to pause here. When we come back, we'll talk about how menopause puts women at greater risk for multiple conditions and health issues, and how to counteract those risks and issues. Stay with us. Welcome back to Healthy Living for Life. Going through menopause can raise your risk for a number of health problems, including heart disease, stroke, and osteoporosis. Dr. McMahon and Dr. O'Leary will talk with us about those risks and how women can avoid them. All right, so we're back, and I want to talk about alternative therapies again. So I'm going to switch to you, Dr. McMahon. What other alternative therapies are there for women?
Well, the biggest and newest would be, there's a new laser called the Mona Lisa Touch laser that is used frequently in people that have had breast cancer or uterine cancer, which are contraindications to estrogen, or they just don't like the way the estrogen works. And this is usually vaginal estrogen of some type. Vaginal estrogen is certainly the number one or the starting point for just about everybody. But if they can't use that, this laser is specifically designed to injure the vaginal skin on purpose, about 10% of the vaginal skin. And there's tissue fibroblasts, which are the cells that make new skin. And these fibroblasts come in, and as they repair the 10% damage to the vaginal skin, they also grow new skins. The skin goes from 2-3 cell layers thick to 20-30 cell layers thick with much better lubrication and elasticity of the tissues, and people are able to do what they want to do.
Okay. So before menopause, women are generally at less risk for heart disease. And then after menopause, that sort of changes. Why is that?
We think it's because they lack estrogen. I mean, the estrogen is beneficial to the blood vessels. They help the blood vessels to expand. What's interesting is that women's risk of heart disease and heart attacks is about the same as men's by the time they're 70. And so we think it's the lack of estrogen that actually has a lot to do with that.
What can women do to reduce their risk?
The same old story. Don't smoke, exercise, try to control their weight. Basically, that's it.
Strokes. Strokes are also an issue. What can women do about that?
It's all pretty much the same story. Don't smoke, and I keep saying that, but that's a big one. Try to control your body weight, exercise. Baby aspirin once a day, 81 milligrams, can potentially help with all of that as well. But that's something definitely to talk to your doc about, because that's what we do, and the information changes all the time.
All right, we'll switch gears and we'll go to Dr. O'Leary to talk about osteoporosis. So we've mentioned that several times. Talk in more detail about osteoporosis and menopause.
Yeah, so osteoporosis, again, our pesky friend estrogen, when we decrease that, it causes a lot of issues, also on the bones. A few things that you can do to help that are not medication related: calcium, vitamin D supplements, actually strength weight training can help build your bone or at least reduce your bone loss if you aren't interested in medications. Hormone replacement therapy is one thing that can help if you are entering the medications for treatment as well. And then there are a host of different types of medications that can help increase or build back bone if you've lost some, in many different formulations, and usually there's a formulation and a route that works well for you, sometimes a daily medication, sometimes a yearly injection. So there's plenty of things out there that can help build that bone back.
So we've touched on it, but let's take a step back. What is osteoporosis?
Yeah, osteoporosis is a definable condition where you have lost a significant amount of your bone mass, making you at increased risk of fractures, potentially life-threatening fractures if it is of, the hip, and we want to make sure that women don't have fractures, especially later on in life.
So we also mentioned urinary incontinence. Let's talk more about that. So why is that an increase during menopause?
Yeah, again, our friend estrogen. So as the estrogen is decreased, like Dr. McMahon had mentioned, it acts in the vaginal area. It also plays a huge role in the skin or in the tissue around the urethra, the tube that opens from the bladder. And so as that tissue also thins, it become weak, and you're prone to leaking urine with just daily activities, lifting, bending, stretching, exercise, and then also having issues with urinary frequency or urgency potentially, the feeling of always needing to go pee, or do I have a UTI? Those symptoms sometimes are just lack of estrogen.
So some women, to counter that, drink less water. I'm assuming you would not advise women to do that, is that correct?
Usually we don't want women to decrease the amount of fluid they're drinking, because that is needed for their body functions. Some treatments of this could include the vaginal estrogen. That also works on the tissue of the bladder, of the urethra. The Mona Lisa laser as well has shown some benefit to the bulking of tissue around the urethra as well. So those are two good options for women.
Okay. So in the few seconds we have left, Dr. McMahon, any final closing thoughts on women?
I guess the only thing I was thinking of with incontinence specifically is physical therapy frequently will help, and exercises that people can do on their own. And that's something we can definitely teach.
Thank you both so much. That was great. Thanks for being here today, and we thank our viewers for watching. Until next time, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.